Hello, everybody. Welcome back to the Incubator booth at NeoHeart 2024. We are honored to be joined by Dr. Anna Penn from Columbia University Presbyterian Hospital. Anna, thank you so much for making time to drop by and being on the pod with us.
Thank you. It's a pleasure to be here.
You were part of this expert panel discussion this morning, which we've already addressed with several of our guests about the heart and the brain, this interplay between these such important organs. For the people who are at home, who are having what we call FOMO, can you tell us a little bit what they missed of this discussion?
Well, they missed an exciting panel.
Yeah,
It was awesome. The main take-home message, I would say, was that we can all learn from our various areas of research and expertise, neonatology, neurology, cardiology, cardiac surgery, radiology, and bioengineering can all come together because the ways that the brain changes when there is in utero compromise or after delivery illness of various types, including congenital cardiac disease, all result in relatively similar phenotypes in terms of how babies develop after the period in the NICU. So information from preterm babies actually can inform how babies with congenital cardiac disease who aren't preterm may develop and what interventions might be beneficial.
I love that. I love that. And some of your work studies also on some of these prenatal factors. We've been talking a little bit about that. Maybe you can share some of your expertise on that front.
Sure. I work in another cross-disciplinary field, which I call neuroplacentology. So brain and placental connections. I study specifically the hormones and other factors that are made by the placenta that potentially we could give back in cases either of placental insufficiency or premature delivery. And there was a little bit of that mentioned this morning. We don't know yet how that would connect to congenital cardiac disease, but I think the fields will start to overlap and inform each other. And so we are looking at particular hormones that are made specifically by the placenta during development that lead to poor neurologic outcomes if they're removed, and whether we can supplement those and actually get better neurologic outcomes. But I think that the take-home message from the panel today was that as exciting as all of these things are, and I'm devoted to studying these things, and it generates a lot of enthusiasm and interest, there are things that we can do right now before we know what the factors are.
Love that.
Yeah, we can really make sure that our families understand the importance of early developmental intervention, and not just going to the early intervention therapist, but helping to empower our families to advocate for the services that they need from the time their baby's in the NICU until school age and later.
I love that. Yes, some of the big topics were nutrition and neurodevelopmental outcomes, the family as being critical to the rehabilitative process, and then the early intervention, but not early intervention we think of after discharge, but starting in the unit with good early continuous therapy services.
And I'd like to think that the model that Columbia has, where we have an infant cardiac unit run through neonatology, is one of the reasons that you'll hear tomorrow. Dr. Nim Goldstrom is going to talk about the data from our infant cardiac unit and the difference it makes primarily for our preterm population with congenital cardiac disease in terms of having improved outcomes. And I think that's kind of the take-home point, is that we all have to work together. It may look different in different places, but it needs to converge.
Yeah, and this is really exemplified by the conference. And Nim has been on the podcast several times to talk to us about what's now known as the Columbia model. And on that note, I guess, why is it important as division chief of such a big unit, why is it important for you guys to associate with the Neonatal Heart Society and be a part of this event?
And this event is the epitome of what I think Ganga Krishnamurthy really wants to promote, which is multidisciplinary team approaches to taking care of our fragile congenital cardiac patients. And I will admit, not having trained at Columbia, coming in from the outside, I was a bit of a skeptic when I arrived about how useful this particular model would be. And I am absolutely committed to it. I mean, the care that's delivered is phenomenal. And it is because it has a baby first, heart second focus. But it's not just because it's neonatology. It's because neonatology can help guide everyone to have a baby first focus and a family first focus.
That everybody buys into the
Everybody
concept.
buys in.
I like that.
And that was exemplified by this session this morning. I mean, as you mentioned, you had neonatologists, pediatric cardiologists, pediatric neurologists, radiology specialists, really not just bringing in people from the neonatology space with various interests, but bringing in the experts to have really cutting edge conversations about what everybody understands from their own perspective. So that's really exciting. In terms of the rest of the conference, I'm just curious if there are any specific sessions you're particularly excited about.
Oh, I'm definitely going to the prematurity and congenital cardiac disease session. And then I'm going to pick and choose and do a potpourri.
That's good. That's good. It's also kind of nice to have a conference in your backyard.
Oh, it's perfect.
No traveling for you.
No traveling for me. And Dr. Krishnamurthy did all the work. So what can I say?
That's great.
A win-win.
Yeah.
It is. It is indeed.
Anna Penn, thank you so much for taking
you.
your time and for dropping by. And we're wishing you a great rest of your conference. And congratulations again on helping putting this together.
Thank you very much.
Of course.